Hello friends. So in this video we are going to see about the basic newborn assessment procedure, and it is a kind of initial assessment which we perform once the baby is born right after delivery. It is called as Apgar score assessment. So let us see what is this Apgar score first. So it is the very first test given to a newborn, occurs in the delivery or birthing room right after the baby's birth. So immediately after birth we are performing this assessment procedure, and it is a rapid method of assessing the clinical status of the newborn at 1 minute of age and the need for prompt intervention to establish breathing. So we focus mainly to identify whether the baby has started normal breathing or not. So it is established breathing, or otherwise we have to go for some interventions. And also it provides mechanism to record fetal to neonatal transition. So this is to assess the ability of the newborn baby to adopt the atmosphere or the environment which is the baby is going to face intrauterine to extrauterine. So these changes, and we can understand by assessing this Apgar score. And this test or this score was developed in 1952 by an anesthesiologist named Dr. Virginia Apgar. And how many times or what is the frequency of doing this assessment? Mainly it is done twice immediately after birth, that is once at 1 minute after birth and again at 5 minutes after birth. And why these two times we are doing it is to understand the differences in the score the newborn baby gets. So sometimes if there are concerns about the baby's condition or the score at 5 minutes is low, the test may be scored for a third time at 10 minutes after birth. So this is third time. So sometimes it happens in rare conditions, or if the baby has not established a breathing and there is no response from the baby side, or the score is uh, extremely varied between the 1 minute and the 5 minute score. Sometimes we have to repeatedly do this assessment up to 20 minutes after birth as well. So there are five factors we are going to evaluate in this assessment, and the scoring we are giving right from 0 to 2, and 2 will be the maximum score, and five criteria, the total score is going to be 10. So these are the five parameters included in this assessment. A stands for appearance or skin color, and pulse we are going to see the heart rate, how it is in the newborn baby, and grimace in terms of reflexes we are going to see, and activity in terms of muscle tone, and finally the respiratory effort of the baby, whether it is established or requires some additional support in terms of interventions that we are going to see or assess in this Apgar score. So this is the picture depicts about score and the criteria or the parameters what we are going to assess in the newborn baby right after birth. As I mentioned earlier, appearance. If you see the highest score, it is given to when the body is completely pink and the pulse rate is more than 100 beats per minute, and if the baby cries and pulls away, and you can see the baby is very active and the movements are very active, and very strong cry if you are seeing, then in this case the baby gets the score in for each parameter 2, and totally the score will be 10 out of 10. Okay, because the respiration, if you talk about the crying baby is a breathing baby and a crying baby is a healthy baby, right? So that is a concept. And when the score 1 is given, when all four extremities are blue in color and less than 100 beats per minute, and if the baby cry is very weak and only arms and legs are in flexed position, but there is no such active movement you are witnessing, and the respiration is very slow and irregular, in that case the score will be given 1 to each parameters, and the score will be finally 5. And when score 0 is considered, completely the body is pale or blue in color, and you are not going to see any pulse here, and there is no response even to the stimulation, either your uh, rubbing the back of the baby or fleeting the sole of the baby. In that case, you are finding no response from the baby side, and there is no active movement or there is no movement at all at baby's end, and there is no spontaneous breathing also. So in that case the score is going to be 0, 10 out of 10. Okay, so this is the scenario, and this is the way how to measure this Apgar score. Total score is 10 and the highest score will be 2, and the minimum or the least score is going to be 0. Now how to interpret these values? As I mentioned earlier, total score is going to be 10, and if the score is between 7 to 10, you can say there is no respiratory depression in the newborn, and if the score is between 4 to 6, then you have to understand that there is mild respiratory depression the baby is experiencing, and if the score is between 0 to 3, it is the indication that the child is having severe respiratory depression. So an Apgar score at 1 minute of 0 to 3 often indicates the presence of secondary apnea. So secondary apnea is caused by mainly when the problem is in the thermoregulation process or any neurological infections, and the secondary causes that may lead to secondary apnea. How we are going to identify is when the score is 0 to 3. Okay, that is at 1 minute. That may be the reason. Then infants who fail to achieve an Apgar score of 7 by 5 minutes of age should have repeated Apgar score every 5 minutes until the score is at least 7. So by this way we are understanding that at least the baby should get 7 score out of 10 to maintain the normal physical parameters, right? And there is strong association between Apgar scores of 0 to 3 at birth, 1 and 5 minutes with mortality and cerebral palsy. So this is the proven fact that there are so many research studies conducted on this, and this was the conclusion. Okay, so there is a strong association between Apgar scores of 0 to 3 at birth, even if you are assessing at 1 minute and after 5 minutes also. The score remains the same. Definitely that indicates the child is going to have some cerebral palsy issues. So by this time you should have got some idea why we are doing this Apgar score assessment, or what the outcome what we are going to get it once the assessment is done. Okay, so we are going to observe especially the signs of neonatal depression, that is cyanosis or pallor, bradycardia, depressed reflex response to stimulation, hypotonia, apnea or gasping respiration. So that is nothing but it is a brainstem reflex, and it is the last respiratory pattern prior to terminal apnea. So each one of the parameter like appearance, pulse, grimace, whether it is achieved or not achieved. So based on that, the symptoms are going to be exhibited in the normal newborn when you are assessing the newborn. So these are the expected outcomes. Whether it is achieved or if not achieved, then these may be the issues. So accordingly, we have to plan for the intervention. And when we talk about this Apgar score and resuscitation, the 5-minute Apgar score and particularly change in the score between 1 minute and 5 minutes is a useful index of the response to resuscitation. Okay, so mostly we are comparing this 1 minute score and the 5-minute score, and if it is not satisfied, we are going to the assessment of this Apgar score for the next third level, that is 10 minutes. So if the Apgar score is less than 7 at 5 minutes, the neonatal resuscitation program guidelines state that the assessment should be repeated every 5 minutes for up to 20 minutes until unless the baby gets the score of 7. This has to be repeated. And the important thing is American Academy of Pediatrics, they have given a format. It is called expanded Apgar score form. And if you see in this illustration, you can see there are Apgar score criteria is mentioned with all 5 parameters and the scores also given. And below that you can see the comment box. On the right side you can see the gestation age that is mentioned in weeks, and then the duration of assessment: 1 minute, 5 minutes, 10 minutes, 15 minutes and 20 minutes. So up to 20 minutes we have to repeatedly do this scoring procedure, and we have to make sure that the baby gets a score of 7, right? And below that you can see resuscitation also. When we are performing the resuscitation at 1 minute, 5 minutes, 10 minutes, 15 minutes and 20 minutes, you're going to see the oxygen saturation level, positive pressure ventilation, ETT also sometimes, and chest compressions, and the administration of epinephrine. So these are the expanded Apgar score form recommended by American Academy of Pediatrics. So though there are some advantages and uh, the positive sides the Apgar score has got, but still there are some limitations. Those limitations are this is an expression of the infant's physiological condition only at one point in time, which includes subjective components. Okay, so they are considering that this is just an expression of the infant physiological status. So there are numerous factors that can influence the Apgar score, which includes maternal sedation or anesthesia during delivery process, then congenital malformations of the newborn, then the gestational age of the baby, then trauma and inter-observer variability. So these are the additional factors which may influence the Apgar score. So there is no um, such a thing that these Apgar scores cannot be influenced by any external factors. But there are some factors. These factors can influence the score. So that's why the baby gets a score of sometimes 5 or sometimes 4, 3, like that the variations happens. The next limitation is elements of the score can be subjective and partially depend on the physiological maturity of the infant. So maturity also plays a vital role because definitely in lower birth weight babies or the preterm babies, this maturity is not going to be seen. So automatically the score is going to be very low in terms of LBW and the preterm babies. So the scores may be affected by variations in the normal transition as well. For example, lower initial oxygen saturations in the first few minutes need not prompt immediate supplemental oxygen administration. It is understood that this is normal in the term newborn babies. The saturation levels will be very low in the first few minutes. Okay, so it is confirmed by the neonatal resuscitation program. Also, they are stating that at 1 minute, the saturation level will be between 60 to 65%, and at 5 minutes, it is going to be 80 to 85%. So it is not necessarily that we have to immediately start supplemental oxygen administration. Okay, and on the other side, the healthy preterm infant with no evidence of asphyxia may receive a low score only because of immaturity. Okay, we have to understand that the preterm baby is healthy and there is no asphyxia, but still the score is less. That is purely because the immatured physiological organ or physical organ. That may be the only reason why the baby gets very less score during Apgar score assessment. And if you see, there are some recommendations also. The Apgar score does not predict individual neonatal mortality or neurological outcome and should not be used for that purpose. Okay, so it is not a tool to predict individual neonatal mortality, or we cannot use this score to rule out some neurological outcomes. And when a newborn has an Apgar score of 5 or less at 5 minutes, umbilical artery blood gas from a clamped section of umbilical artery should be obtained. So this is to rule out mainly. Sometimes it is due to neonatal encephalopathy, that is the baby gets a score of 5. So this can be analyzed by using the umbilical cord blood sample, and we are going to see the acid base imbalance that we are going to see, and it can be identified whether the baby is suffering from neonatal encephalopathy or not. And another recommendation is submitting the placenta for pathological examination may be valuable to rule out the other hidden problems which the newborn has by birth itself. Okay, so these are the recommendations given by various research scholars after conducting successful studies and on large number of samples, and they have come to the conclusion these things are recommended because Apgar score is not the final tool to identify the neurological problems. Okay, it is maybe useful to identify whether the newborn is having asphyxia or any respiratory related issues in the beginning stages that can be managed by giving CPR or supplemental oxygen administration, and it helps to establish the normal breathing in the newborn babies. So other than that, it is not the tool to use or to identify some of the major disease conditions like neurological diseases, right? So additionally, we can go for the umbilical artery blood sampling if the score is 5 or less at 5 minutes, because it is expected that at least 5 minutes and 10 minutes score should be more than 6 or at least 7. It is expected in the normal newborns. Still it is 5. Then there are some factors the baby has inside physiologically that has to be ruled out. Right. So this is all about the Apgar score assessment. Thank you.